Good evening and welcome to the Clarkson University Library's workshop on finding answers to clinical questions efficiently and effectively. My name is Mary Cabral and I am the Health Sciences Librarian at Clarkson. And I'm glad you could join me this evening. To note, I am recording this session. If you want to keep your audio or your video muted at your discretion. And please feel free to ask any questions that you need to as we go along. You can either unmute to just vocalize, or please put things in chat and I can take a look at that as I pause. So we'll get started. I think you can see my screen. So finding answers really starts with being reflective about what you are trying to answer. This session will introduce some strategies for conducting an efficient and effective literature search in some key health sciences databases. To give some context to the literature search, though, I want to start with the concept of evidence-based practice. The classic definition of evidence-based practice is from Dr. David Sackett, a Canadian medical doctor and an EBP, that's the evidence-based practice pioneer. He stated that evidence-based practice is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of the individual patient. It means integrating individual clinical expertise with the best available external clinical evidence from systematics research. So EBP is not only about applying the best research evidence to your decision-making, but also using the clinical experience, skills, and training that you have as a health professional, and taking into account the patient's situation and values, like their social support around them, their financial situation, and other factors. It also takes into consideration the practice context. Do you have limited funding? How many practitioners are there? Where you are working? So the process of integrating all of this information is known as clinical reasoning, when you consider all of these elements in a way that allows you to make decisions about the care of a patient, you are engaging in evidence-based practice. So what's involved in this process? We can think of EBP as being comprised of the 5 A's. We've all heard of the 5 W's of reporting: who, what, when, where, why. This is a similar prompt to help remember the steps of evidence-based practice. So it starts first with assessing the patient. What is the clinical problem or question that arises from the care of the patient? Moves on to asking the question, constructing a well-built clinical question derived from the case or the patient's care, acquiring the evidence, selecting appropriate resources and conducting a search, that would be a literature search, to gather the best evidence to answer the question. Appraising that evidence next, critically evaluating the evidence for validity, closeness to the truth, its applicability, which is its usefulness in the clinical practice, and as well as the impact. We move on to applying the evidence to the clinical practice. So integrating your critical appraisal with your clinical expertise and the patient's unique biology, values, and circumstances. And we eventually get to evaluating the efficiency and the effectiveness of your performance and seeking ways to improve. And this isn't always just a straight line. We sometimes cycle back to different portions of the process. This session is going to focus on the third component, acquiring the evidence, which involves searching the medical literature, because the evidence is research and the write-up of the research, which would be the literature or a journal article. We'll look at a variety of sources, and I'll do some database test searching to demonstrate the capabilities of these tools and share some tips and tricks along the way. But before we get there, some notes on asking the question. Research is like going on a trip. Some advanced planning can go a long way into smoothing the ride. Before you search, it's important to know what you are looking for. And a common tool in building a well thought out clinical question is PICO, P-I-C-O. Sometimes T, You'll see that in a moment. Utilizing PICO facilitates asking a focused, clinically relevant question. It also will help identify keywords to use in searching the databases. Let me break it down. So the first stage of any search should be to define what it is you're looking for. And the best way to define your search topic sometimes is to ask a question. Turn your topic into a question that you need the literature to answer. And then you can ask more questions about the type of information you want to find to answer this question. So one way of breaking down a research question involving patient care starts with the patient and is known as PICO, or silent T, we'll say. In some instances, as an aside, this might be too complex a process for what you're searching for, but it can be a good exercise to help map out your question and breaking it down into concepts. Briefly, I'm not going to spend a lot of time on the PICO today, but briefly, the P stands for the patient or your population or the problem. Who or what is the question about? What is the disease or condition you need to research? How would you describe a group of patients similar to yours? Do you need to consider age, gender, or other characteristics? Does the patient have any other conditions or medications that they take? So that all falls under that portion of it. I equals the intervention or the exposure or the prognostic factor. What is the plan for the patient? What is the main intervention or treatment you're considering? Think about the type of treatment, diagnostic test, drug, procedure, therapy, the intervention level, the dosage or frequency, or maybe even the stage of intervention. Are we looking at preventative care, early, advanced, and the delivery? Who is delivering the intervention, and how does that work? C is the comparison. This compares the effect of the intervention to maybe no intervention or an alternative treatment. Sometimes there's a gold standard diagnostic test or treatment for something that you might compare to. There might not always be a comparison. O is simply the outcome. What are the intended or potential outcomes that you're looking for? What are you trying to accomplish or to measure or to improve? What are you trying to do for the patient? Are you trying to relieve or eliminate symptoms, reduce the number of adverse events, improve function or test scores of some kind? And T is the time involved to demonstrate an outcome. And there may not be, portions of every one of these pieces or information for every one of these pieces in every case. So once you've developed a question, you then must identify the key concepts within it. Which concepts must every paper or article that you find address in order for it to be relevant to you? Identifying these concepts makes it easier to determine and combine the appropriate search terms, and you'll use the search terms to retrieve the information that addresses your question. These are the terms we use in the database searching. Once you've formed your question using the PICO structure, you can think about what type of question you're asking, and so what type of study might be most relevant to answer it. And that also helps you determine which database you might use. There's a tip. I have developed a really comprehensive PICO worksheet that can help you map out the question, and I'll point out later on the website where that is. So your next step is determining your search terms. If you type your question straight into a database, like you might in Google, you're not going to get very good results. It's essential to break your question down into its component parts and develop a search strategy. You need to think of all the ways each of your concepts could be described in a paper. It's important to spend some time generating this list. Your search results will only be as good as the information you put in. There are two types of terms you can use in searching for information. On clinical questions, sometimes there's unique purpose and you might get different results. So the first is what we're used to, keyword searching, sometimes referred to as free text searching or plain text. It might bring up all the records that contain a given word or phrase, regardless of where in an article the words might appear. It's natural language or everyday speech we're looking at. Sometimes some medical terminology can be used as keyword searching. It looks for those exact words or as exactly as you typed them within a database. So this means it's important to be accurate. Make sure that you don't have spelling errors. The databases are literal. They won't correct you the way Google might. You want to think of synonyms also. And a reminder to use potentially the singular and plural form of a word when you're looking at it. Keyword searches are fast and easy. It's the normal way that we're comfortable searching, and can often lead you to sufficiently relevant articles, but it's up to you to come up with those search terms. Here's a tip to make the most of keyword searches. You might use some search techniques such as truncation, using Boolean operators and phrase searching, which I'm going to go over in a minute. The other way, other kinds of terms you might use are subject headings, particularly in the health sciences and medical fields. It's called medical subject headings, or MESH. A subject heading is an assigned word or phrase the database uses to describe a concept. It's sometimes known as controlled vocabulary. And there can be some advantage to using controlled vocabulary. It can make your search more precise. It can increase the relevancy of your results, especially in looking for medical research. Indexers of the databases have done a lot of the work for you in tagging the articles with these subject headings. And I can show you when we get into the databases and do some example searching, there are a couple of ways to figure out what MESH the medical subject headings are. Sometimes you can do a quick keyword search and browse your list of results, find a few articles that are relevant, and those article records will then indicate the subject headings that the article's been tagged with. There's also actually a subject heading list that you can browse. So that can be useful. Executing your search. You formulated your question, you've broken your question down into its component concepts, you've figured out words to describe those concepts, and how do you put it all together to search for, and more importantly, find the articles or answers you're looking for? What limits or parameters are you going to set on your search? So again, databases, and this is where I'm gonna urge you to use databases to find the medical literature that will answer your questions. You need to combine your search terms in a way the database will understand. Again, unlike Google or even Google Scholar, databases don't like sentences when you just ask it a question. It'll just confuse your database and lead to disappointing results for you. There are useful tools to help you craft your search and refine your results for a better output. We're going to take a look at those. Some of these might make a little more sense when we get into doing some example searches. So the first thing I want to look at is Boolean operators. So you see a picture of this gentleman. His name is George Boole. He was a British mathematician from the 1800s, and he developed an algebraic system of logic that's now widely used in computer and electronic systems, including database searching. While Boole's algebraic system can be complex, very simple form of Boolean logic is used when we're searching in literature. Boolean terms simply are and, or, and not. When you combine your search terms with and, records retrieved, you're asking the database to retrieve articles that include all of those words. The more terms you and together, the fewer records you'll retrieve. It narrows your search results. When your terms are combined with or, you broaden a concept. Or is helpful when searching for synonyms. It tells the database that words can be used interchangeably. So it will retrieve items containing either of the words that you've indicated. This expands your search. So the more terms you or together, the more records or articles you can retrieve. Using the term not allows you to exclude concepts not relevant to your search. This limits the return of your results. It places definite limits on your search, so you want to be careful where you use it, but in some places it can be very, very helpful. So you can combine several search statements also into one comprehensive statement or a search string by nesting or mixing these Boolean operators. Important to note that if you are going to indicate Boolean operators, you must put them in capital letters to make sure the database recognizes them as a thing to do, not just a word to search for. Databases will not search for words like and, or, not, other small words of, for, the. Well, they're called stop words. They're not significant enough to be indicated in your results, so it won't actually use it as an operator unless it's capitalized. Also, in the advanced search feature in the database, in most databases, it gives you a way to map out that process without even having to indicate them. Some other tools that are useful: truncation, sometimes also called stemming. Most databases are not sophisticated enough to search for all variants of a term automatically, the way Google and Google Scholar do. You can combine them in a search string using OR, but an easier way to do it is to truncate or shorten a word to its base form. It's usually an asterisk that you use to indicate that you want the database to look at all variants of the term. In this example, we see that therap with the asterisk will find therapy, therapies, therapeutic, therapist, therapists, and anything else that would come after that. Phrase searching helps when you want to search for words that are adjacent or right next to each other. They're together in the order which you've entered them. You can put the words into quotation marks, telling the database to look for those exact words in that exact order. Some databases don't handle phrase searching so well, or maybe an author hasn't thought of a phrase in the same way that you have, so you want to be flexible in maybe trying it with phrase searching and without. Wildcard symbols allow for variations within a word. Sometimes words are spelled in more than one way, or you can indicate a plural in the way I have here with woman or women. Orthopedic, the US versus UK spelling, the British spelling. What the wildcard symbol is, whether it might be the hashtag or a question mark or sometimes an exclamation point, depends on the database. And if you use their help features, they'll have an indication of what the wildcard symbol should be. Proximity operators or characters within a word. It can help you, helps you find words that are nearer to each other. In this example, if I say screen, the asterisk there is for screen, screens, or screening. N5, cancer, that means please look for the screen within 5 words of cancer. Some databases use an N, capitalized or lowercase, for near, or a W. Again, looking in the help feature will tell you which proximity operators are useful in a database. The closer words are together, the more they are likely very related, and so that can help narrow down your search sometimes. Using parentheses to couch your terms together with the Boolean, also using the Boolean will help the database understand how you're thinking conceptually. And then there are also limits. Much like web shopping, we have limits that we can use, or filters that we will find on the side of our Amazon list or database that we can just click on and have it filter in or filter out. This could be language, age, gender, the dates of publication, the type of study, things like that. Each database will offer a variety of different filters. So, armed with all of that information, you'll head to a database to start searching. And you might ask, if Clarkson has access or we subscribe to hundreds of databases, which one do you use? Which one you use depends on the kind of information you're looking for. And in this instance, you're going to be focused on the medical or health sciences databases. Things like PubMed, CINAHL, Cochrane Library. There are others that are more expansive to disciplines like Science Direct or Web of Science, even Google Scholar. Google Scholar is not technically a database, but it is also a very useful search tool when looking for literature. I suggest exploring more than one. They don't all access the same batch of information, or they don't all look at the same journals. Use the advanced search features that are available, because that can help you map out your Boolean search. Try a variety of keyword terms and combinations, and use those limits to narrow your search. And in almost all of them, including Google Scholar, you can create a free account within the database. And I suggest doing this, especially if you're doing longer term research. It can, you can save your search history, you can save search records. If you've crafted a very specific search formula, then it will save that. Also, you can also set up search alerts to receive emails when new information comes up under a particular search. We spoke about this already for a moment before refining your search by limiting its scope. Also important to be willing to adjust your search strategy. Sometimes you might not be finding the kinds of results that you thought you might. So be willing to adapt the search. Sometimes you consider your first search strategy to be a first draft, and checking some results, adjusting the strategy, your search terms, how they're combined. Try a different database. Sometimes changing your context can really change the results you get. Be flexible, approach your topic using as many search strategies as you can think of if you're not finding what you need. And if you get stuck, don't spend all day with a futile search. Instead, ask for assistance. The librarians are here to help, and we can brainstorm with you at any point in your search process. One thing that can be really helpful is to use a seed article. If you do some quick searching and you find one or a few articles that really feel spot on, I think of those as seed articles that can help grow or expand the number of articles that you might be able to take a look at. One relevant citation can be a useful tool. What you can do with one article is you can look backwards, forwards, and all around. Looking back is looking at the references in an article. Every research article is going to have a reference list, or it might be called a bibliography, the works cited. There are different names for the same thing. Look forward at who cites the article you're reading. Databases, Google Scholar does this also quite well. They may also, if you look around, to find similar or related articles. And then also look at the subject headings and keywords that are assigned to that article. They can be some clues to expanding on your search terminology or changing up your search terminology. We'll take a look at that. Okay, so I have made mention more than once of, well, that might make more sense once we get to the databases. So let's take a look, go online to the website and take a look. I'm going to stop sharing my screen at this moment. Stop the slideshow, sorry, is what I mean. And we're going to go onto the web. So you want to start with a library database. And how do you get to the library online? You can either start at the clarkson.edu homepage, and all the way at the bottom, there is a link to the university libraries. Also, if you're a Clarkson student, staff, or faculty member, you can enter from the Clarkson intranet under quick links. There's a link to the library, or you can simply just type in clarkson.edu/library in your URL box, and it will take you to the libraries. For health sciences related searches and medical searches, I'm going to suggest that you start at the Health Sciences Library, because I've curated this page to have the most useful things to you in for medical research searching. I've parsed out occupational therapy, physical therapy, and physician assistance guides. You can look at any of those, and then there are some other related and very useful resource guides here. Before we take a look at the databases, I have some top resources listed here, and the health sciences databases. Before we jump into that, I want to suggest that sometimes it's really helpful to background yourself on a topic. Go to a source that might help you understand the terminology around a particular topic or the language that's being used and get a general scope. And one way to do that is to use something like UpToDate. It is a database that the library subscribes to, and you can really, what it does is it brings together the most current research on a particular health topic and puts it in one place for you. Let's see, we'll look at something like, I was looking at concussion earlier. Okay, it has an auto-suggest feature, just like Google. And so I can take a look at my results. I can, refine them a little bit here, but just to give you an idea of what it looks like, if I pick this topic, concussion in children and adolescents and management, you can see that the information here is informed by a literature review. And the literature review that informs this article or these pages is up to date from August 2020, which is, and so it's very, very recent. And what you have here is it's almost like an encyclopedic article. You get summary and recommendations, an introduction, clinical manifestations, management, all of these different things, symptoms, complications, prognosis, prevention, information for patients, additional resources, references. If you click on that, that's going to give you the articles that were found and read to inform this information. So you can go to the direct source of the information. And there are also often graphics, and then there's the related topics. So this is a way that you can find, again, for backgrounding yourself. Some other ways that could be easy to do this, there are two free resources. Medline Plus is the first. I'm just going to Google that and get to it. And Medline Plus comes out of the US National Library of Medicine, the NIH National Institutes for Health. All the information here has research behind it, but this is made to be patient-friendly with easy to understand language. If we go to health topics, I can either do a quick search for something specific that I want to find out more about, or I can browse the topics through A to Z. And again, I'll just pick something here. Doesn't really matter, does it? Antibiotic resistance, here. Just want to give you a sense of the kind of information available. You get a summary, again, diagnosis and tests, treatments and therapies, related issues, images, and then there's also research linked to it, statistics, clinical trials that might be available, and journal articles. So another place not only to get some background, but you can also gather some literature here. So those are two good ones. The other that I might recommend is called the Merck Manual. Merck Manual has both a consumer and a professional edition. I won't do a search here. It's very similar in being able to browse medical topics or do a search. And again, it gives you a real encyclopedic concept in terms of giving you all the background information about a particular topic. So backgrounding yourself and then going to one of the databases to find the literature you might need. So I'm always going to suggest that you start with PubMed. So PubMed is the world's largest biomedical database of research. And so it's always a good place to start. And again, I recommend that you don't limit yourself to just one database. If you're just looking for some quick information, you might pull journal articles out of one of those backgrounding places, UpToDate, Merck Manual, Medline Plus, or you might do a quick search here and get just enough to answer the question that you need. If you're trying to do something much more comprehensive, then you're going to gather information from, I'd say, 1 to 5 databases and take a look, a much broader scope systematic look at the literature that's available. So PubMed has something, I know I talked about all of those different ways to combine terms, but they use something called automatic term mapping. So when you type in a particular, when you type in your keyword searches, let's look at something like, I'm gonna look at arthritis, edema, and treatment. Another word for edema would be, I might have put in more terms like swelling, inflammation, and I could do that. I could, let's change that just a little bit. I know I'm only getting 12 results, and I'm trying to figure out why it might be such a small number of results. And it's because in my filtering, in a previous search, I had limited my search to by age, adult, 19 to 44 years. If I take that out, I'm now going to see I have 586 results. That's still a little curious to me why I don't have many more results on arthritis treatment, but I could expand this because maybe the authors of these articles didn't use just edema, they might have used other words to describe that concept. And if I expand with my Boolean terms, Boolean operators, excuse me. I'm going to expand a little bit here with some other words for another word for treatment, management, swelling or inflammation for the edema. Take another look. It's limited it. Again, I'm not, did it keep the filters? No, I did not. It's because I have things spelled wrong. I do mean that. All right, so PubMed has gotten almost as smart as Google, maybe smarter, in suggesting to me that I have misspelled something. And now we see a number that I would more expect. I've got 27,000 results. And I can use those filters over here, and I can say things like, well, I only want to look at clinical trials, or only randomized control study, or a systematic review, and I want to look at more recent information. I'm going to limit it to 5 years. I only want to look at things that I can read the full text of now. Clarkson doesn't subscribe to all journals, so maybe some of these results won't bring me to the full text. And so I still have thousands of results. I'll look at a systematic review. A systematic review is going to have a lot of literature informing it. So if I take a look at any one of these by clicking the title, I want to show you some of that information I was talking about. Let's say that this is one of those spot-on articles that I think could help me be a good seed article. And here what I've got is the article record. It's giving me the abstract. It's telling me some keywords that have been identified. It's being tagged with, the way we, if that helps to understand that. Similar articles cited by, related information. I don't see a link to the reference list just yet, but we're going to go look for that in a moment. So we see the forward, which is the cited by down here, and I can link out to any of those articles. They're hyperlinked. Here is the similar articles, the all around. Not only do I have keywords that I can take a look at to potentially adjust my search terminology, but here are those medical subject headings. I remember I talked about those in the slides and understanding how do I know what a medical subject heading is. If I were to click on any one of these, arthritis, psoriatic, drug therapy, that will take me to all of the articles that are tagged with that. It's going to take me out of my search also that I constructed, but it will take me to all those articles. So I could go and do that, or I could just indicate that I want to use that mesh terminology within my search. And how I might do that is if I do an advanced search, I can say in the mesh terms, and I could type out that mesh terminology that we saw listed in that article. The other way I could do it is I could just click on that, but I could build it using that advanced search feature and connect it to the other search terms that I had already generated. So what I want to look at also is I want to look at the reference list. And in order to do that, I have to look at the full text of it. I'm not seeing it here. So I see over here full text links. I see a couple of different ways. I might go through Clarkson University full text. There's Elsevier open access. Anytime you see open access, that means it's freely available. So you're going to get right to it. So that's worthwhile doing. And so again, what I have here is it's brought me to a different database, ScienceDirect, that is offering me the full text access where PubMed did not. And here I can do that same thing. I can look at the keywords. I can look at the references here if I link there, and then I can see them. I can also do that by downloading the PDF. The PDF will not have the hyperlinks to the reference articles, but that is, you can take a look at that. But the article record often. So here's the full text in a PDF format. And that's probably what you want. That's our end goal most of the time, right? We want to get the PDF so that I can read it either on my computer or I want to print it out so I can take a look at it. I can share it with my lab partners so that they can read the same information that I have. So that's in PubMed. So that was just doing this really, really quick search. I want to show you another way that PubMed will do what I called the automatic term mapping. If I were looking at nosebleeds in children, say, and I would call it a nosebleed, whether I'm in the clinic, I'm a patient, and I'm going to say I have a nosebleed, and I might take a look. What I didn't point out before is that PubMed will highlight your search terms. And here I'm not seeing nosebleed. Well, I do, I see it here, nosebleed. But some of the first results we see, I keep seeing this word epistaxis. And that's the MESH subject heading, the medical subject heading for a nosebleed. And so I want to take a look at this briefly, show you, again, if we look at our MESH terms here. So epistaxis etiology. If I click on that, I want to show you what it looks like in the MESH database. Here's epistaxis. Tells you what it is. It's bleeding from the nose. You can, here's some other terms that would bring that up. Nasal bleeding, nosebleeds, spelled a number of different ways. And it shows you where in the MESH categories it lands. And you can click any of these to continue exploring the MESH terminology. So that can be very useful. Note that if you are in the MESH database, when you do a search, you're not going to get articles. That's not what this database is about. It's more like a dictionary of medical subject headings. You have to be in the PubMed database in order to, I guess we don't get to it from here. We can just go back to this and go to PubMed. Here we go, all databases. Well, PMC, oh, here we go, PubMed. PMC is PubMed Central. Here we go, and I could do my search from here, or just so I can navigate backwards. Let's take a look at a couple other databases, like CINAHL. CINAHL stands for, I'm trying to remember, Comprehensive Information for Nursing and Allied Health Literature, I believe, or something very similar to that. Again, let's do something like this. I want to just show you a little bit of how I might craft that search. So what I did here was I'm looking up traumatic brain injury, and I want that as a phrase search because I want those exact words in that exact order. Or I know from previous searching that it's sometimes simply called a TBI or concussion. They're related, or it might be, a concussion might be one type of TBI. And then I want to look at a specific age range, and I want to look at adolescents. And so teen with an asterisk will get me teen, teens, teenager, teenagers, Adolescent with an asterisk will get me adolescent, adolescents, CE or TS. So we're going to throw that search out there. Again, I have ways to limit it with my by date or by type of publication. We'll just look at academic journals. I still have 4,000 results. Again, these are, I've chosen search topics that I understand that there's a lot of information about, but when you craft your clinical question, it will likely be much more specific than the kinds of searches I'm doing right now. And you can see right here, if the full text PDF is right there available, if you open up any one of the articles, again, we see we've got a lot of information. Here's those major subject headings. They're calling it minor subject headings, so lots of information about the article and then getting to it. What I'm not seeing here, I think that if I went to, I'm not seeing the cited by or related. It looks like perhaps CINAHL doesn't do that as much as PubMed does. You could get to the reference list by looking at the full text PDF. I know that many people, I want to recommend that PubMed is freely available to use for anyone. You do not have to be part of a university community in order to utilize it. And it can lead you to there's a lot of open access or free content. Google Scholar also, we're going to go to that. The spelling at the end of the day is not so great. Is also it's a good search tool. The way databases are, it's not as precise. It's a much larger umbrella over a variety of disciplines. And it doesn't allow you as many ways to manipulate your search terms or to filter your results. So we'll use phrase searching. We'll use Boolean. We'll just do that quickly. I think you get the point and all that. What I want to show you is that in your search settings on Google Scholar, there's something called library links. And if you indicate Clarkson University Libraries, if you don't see anything here, search for Clarkson University Libraries, checkbox it, make sure it's there, because then when you go into your search, okay, we're gonna skip that briefly. It will show you these links. It connects to Clarkson Full Text if we subscribe to the content of the journal. And so if there is a difference between opening up the record from here versus over here. If there is no link here, if you open up this, we'll just take a look and see. This is going to bring me to, it's a PDF. Actually, it looks like a not so great photocopy or scan of an article. Bringing it right directly to that full text, that's a little odd. I don't see that often. Or you can, here Science Direct is bringing you right to this. You can download the PDF. Again, the usefulness in doing this is that it gets you to all of that information I was talking about. The references, the cited by, other recommended articles, and terminology that has been assigned to that, so it can expand both your opportunity to search further or to expand your knowledge on that. Okay, I'm going to stop there. I just want to come back to the website for a moment to show you, again, this list of health sciences databases. They're not the only databases we have here at Clarkson. You can click through to a full list of what we have, but also descriptions of any of these. But for any medical or health science topics, this grouping, you're going to be able to find, I believe, what you need that way. Some of those, the tips and tricks and search strategies, I do have a worksheet on that. If you click on the guide to literature searching on the left, under these tip sheets, I've got that database search tips. I also have some Google tips for research, which we didn't cover today, and also a copy of a PICO worksheet that I mentioned, where it allows you a place to map out your clinical question, break it down into your concepts, and then take those concepts mapping it out in a way that Boolean can be useful, and bringing that to your database in order to perform the search. I want you to also note, we started with the concept of evidence-based practice. Evidence-based medicine is really the same thing, and there's a lot of information there if that's of interest to you. Resources for evidence-based practice here, created by McMaster University Health Sciences Library, a great and extensive library. I applaud colleagues who are there. I want to stop for a moment and see, before we end, if you have any questions. Let me go back to that website for just a moment. There we go. Because I want to, if you don't have questions now, at any point that you have questions, please do not hesitate to contact me or one of the other librarians. If you send an email to Ask a Librarian, there's a handful of us that get that, and any one of us will answer you within a very short amount of time. My direct contact information is here, and I welcome that. We can set up, if you come back down to the bottom of that Health Sciences Library page, there's a link here to click, and you can self-schedule a meeting with me, and it will also auto-create the Zoom link, and so we can have a one-on-one conversation or research consultation. With that, I'm going to open it up for questions and see if I can help you out in any direct way today. Let me open up the chat here, see if there's anything in there. There's the chat. Will this Zoom be available to refer to? Yes, I am going to post this. Let me show you where, so you know where to find it. If on the library website, you go to library workshops, and under, we've got general workshop series, graduate workshop series, workshop recordings, and graduate workshop recordings. I'm not quite sure why there's a difference. I'm going to place it under the fall 2020 workshop recordings. You will see it listed here, and you can take a look at that anytime. Any other questions? Okay, thank you for joining me this evening, and I wish you well in all of your searching. Hope to talk to you soon. Thanks. Bye-bye.